Good afternoon, all the second year student. Today we will start the new chapter, psychotropic drug or psychopharmacological drug. Or psychotropic drug. You know, psychosis, that is mental illness. The patient is suffering from the mental processes or mental retarded, that called the psycho, that is a mentally disorders, or psychotropic drug are used in the treatment of mental illness patients. Now, an agent having primary effect on mental process are called psychotropic drug. They are useful in the mental illness. Psychotropic drugs are useful in the treatment of mental illness. Depending on their primary use, they can divide it into four groups. They are having the four groups depending on the primary use. And the first, anti-anxiety agent. It may also call as minor tranquilizer. Tranquilizers. It is used in treatment of anxiety and phobic state. It is used in treatment of anxiety and phobic state. Now, the phobic state means abnormal fear is generated. So the abnormal dare or fear, that called the phobic state. Anxiety, the anxiety, a feeling of apprehension. The anxiety is one type of feeling of apprehensions, uncertainty. The fear without apparent stimuli. The fear without apparent stimuli associated with physical changes take place. Sweating, tremor, tachycardia. That is called as the anxiety. Again, I explain. Anxiety is a feeling of apprehensions, one type of the fear in the mind. The uncertainty of the fear is occur without any apparent stimuli associated with physiological changes, tachycardia, sweating, tremor, etc. That's called the anxiety. Second group, antipsychotic. It may call as the neuroleptic. Also called as the major tranquilizers. Used in the treatment of all psychosis. All the psychosis and schizophrenia. And third, the drug use the drug for effective disorders. One, antidepressant, for depression, you know very well, and depression. Anti-manic, that is called the mood stabilizer. Mood stabilizers. And the fourth, last one, psychomimetic. Psychomimetic, it called as the hallucination, abhas. Which produce the psychosis like a state. The majority drugs of abuse, the drug are used in the psychosis is for the drug are use of abuse. Abuse in the sense that is misuse of the drug. Misuse of the drug. Drug may use not for the illness purpose but use another purpose, that is abuse, misuse of the drug. Okay, now see the first, anti-anxiety. Now you having the anti-anxiety and the psychotic drug in the syllabus. Now we will discuss the anti-anxiety. Anti-anxiety drug. Anxiety drug or anxiolytic drug that are decrease the anxiety. Anxiety, chinta, worried, fear, apprehensions. Some people having event of fear, and that drug which decrease the anxiety, tension without producing sleep. All the tranquilizers are the drug having some degree of sedation. All the tranquilizers you have to take, they are having some degree of sedations. Now these drugs are having falls in the four category of drugs. Now first, benzodiazepines, diazepam. You has been already studied on sedative-hypnotics, benzodiazepine, oxazepam, lorazepam, alprazolam. Second, propanediol derivative, metrobamate. Third, candidions. Example, buspirone. Fourth, beta blocker, propranolol. Now, these are the four category of drug commonly used for the benzodiazepines category of the drug, always used in the treatment of anxiety. Okay. Now, the benzodiazepines drugs. Benzodiazepines of drug already you have studied in the sedative hypnotics. The benzodiazepines, the long-acting benzodiazepines relieve the anxiety. They have selectively damning effect on aggregation of animal and aggressive animal. They are useful in the anxiety and the stress symptoms. This class of drug widely used in treatment of the psychosis, anxiety. They are acting primarily in the GABA transmissions. The high dose of the benzodiazepines produce the sleep. Then you can use the high dose of benzodiazepines. They are commonly used in treatment of anxiety. The side effects, all the tranquilizers having the sedation effect, increase the sedation effect, increase the appetite good. You can sleep much more and automatically your appetite should be the increase, khana and the sona, and automatically weight gain is increased. Now another is a weight gain is there, and alter the sexual functions. Another adverse effect, the alteration in sexual function. That is another disadvantage, that is adverse effect of anxiety drug. Now so many drugs are there. You already studied in anxiety. Their dose is different for the sedation, and here the dose is used very minute quantity. For example, alprazolam, the dose are used 0.25 to 1 mg. It's very minute. Their dose, it is effective in the treatment of anti-anxiety and depression. The most commonly used the alprazolam, effective in the panic disorders. Effective in the panic disorders of anti-anxiety disorders. Diazepam, another drug used to reduce the anxiety. It is used in the acute panic. Now it's used in acute panic of the state. Anxiety associated with the organic disease. Anxiety associated with organic disease. Now next drug You can study the see the chlorodiazoxide or use marketed name is Librium. This drug acting on the chronic anxiety test. It is used for the chronic anxiety state. Commonly these are the used. It is also having the poor anticonvulsant effect. Poor anticonvulsant effect. The dose is 20 to 100 mg. 20 to 100 mg. Now therapeutic uses. It is used in treatment of anxiety and neurosis. Second, it is used as a sedative hypnotics. Third, it is used during withdrawal of alcohol. And fourth, in the treatment of convulsional seizure. Convulsions seizure, the dose should be used 200 to 400 mg 3 to 4 times a day. 3 to 4 times a day. Now, next, psychotic drug. In the psychotic patient, in psychotic patient now see the antipsychotic drug. In the psychotic patient of mental function are sufficiently impaired to meet the demands of day-to-day activity. Antipsychotic drug use treatment of psychotic. In the psychotic patient, the mental functions are sufficiently impaired to the demand by day-to-day activity made. Day-to-day activity. Distortion of thoughts. Thinking distortion, tremendous. They are having in the confusions in the mind, distortion, vicharacha vada, distortion of thought, precipitation, precipitations, the conscious mental retardations of sensory neuron, that is precipitation, hallucination, abhas, deeply thinking about that person and that feeling this guy is in front of you, and delusion, and the false delusions. In the psychotic patient, I always show the distortion of thoughts, precipitation, hallucination, and delusion are the common symptoms. Of schizophrenia. Schizophrenia. Now, what is schizophrenia? Is a psychotic illness is occur due to that the symptoms show distortion, वैचारिक वादन, हम जो बोलेंगे वही सही, बाकी झूठ, precipitation, very, it should be having the confusion in the mental, conscious mental retardation of the sensory neurons, that is called the precipitation, hallucination, abhas, deeply thinking about the person and the feeling about that person's only, delusion, fall, are the common symptoms of schizophrenia. Exact cause of abnormalities is not known, but it is the it is occurred due to the dopaminergic overactivity. Dopaminergic overactivity in the lymphatic system. In the lymphatic system. Dopaminergic activity in the brain. It's occur in the lymphatic system. Most of the antipsychotic drugs blocking the dopamine receptor. The drug of this group is called as major tranquilizers. Or neuroleptic. Based on their chemical structure, the classification as under first, phenothiazine. Example, chlorpromazine, chloromazine, pyridoxine. Second class, deuterophenone. Deuterophenones. Example: haloperidol, trifluoperidol. Third, thioxanthine. Example: chlorothiazine, thiazine. And fourth, miscellaneous agent. Reserpine, loxapine, and clozapines. Now the classification, see the again classification based on the chemical structure and classify as below. Phenothiazine, most common example is chlorpromazine, is commonly used, that is called as a chlorpromazine acting as a largectil. Always ask the reason. Chlorpromazine act as a largectil, is always use the reasons, is act commonly used in the schizophrenia. Now remaining pharmacology you can see in the pharmacology of antipsychotic drug: trifluoromazine, thioridazone, deuterophenones, haloperidol, trifluoridones, thioxanthine, chlorothiazine, and thioxanthine. Miscellaneous agent: reserpine, loxapines, and clozapines. Now the chlorpromazine. Chlorpromazine is a phenothiazine are the most common drug used in treatment of phenothiazine is most commonly used in the treatment of psychosis, and the chlorpromazine is act as a largectil. Now see the pharmacological action. Number one, CNS. Important action in the CNS. In the psychotic patient, chlorpromazine reduce agitation and aggressiveness. Thoughts and behavior are slowly normalized. Thoughts and behavior are slowly normalize and reduce anxiety. Spontaneous activities reduce. Spontaneous activity is reduced. Sedation is not associated with euphoric effect. Sedation is not associated with euphoric effect. Abbas, euphoric effect is not associated with the sedation. Tolerance is developed to the sedative effect. Frequently used, the tolerance is developed for sedation effect, but not its psychotic effect. Phenothiazine do not have the analgesic effect. The drug is phenothiazine, is phenothiazine, no analgesic effect, but potentiate the analgesic effect. Potentiate the analgesic effect of analgesic and produce hypothermia. Body temperatures goes below normal. That is called the hypothermia. Temperature control is lost. Temperature control is lost, and body temperature fall in the cold surrounding. It is not affecting the respiration. Respiration is not affected. This drug is not effective for the motion sickness. Okay, now see again, it's an important action in the CNS. It is used in the chlorpromazine is used in the psychotic patient, that is belonging the category of phenothiazine, and phenothiazine group of the drug used in the treatment of the commonly in the psychotic patient. Now is act in the CNS. How they act in the CNS? In the psychotic patient, reduce their agitation and aggregations. The thoughts and the behaviors is slowly normalized. You can reduce the anxiety. Spontaneous activity is reduced. They does not produce the sedation along with the euphoric effect, but they are having the tolerance due to the sedation, but not in the psychotic patients. Okay, the phenothiazine not act as a analgesic, but they producing the potentiate the analgesic effect, but they potentiate the analgesic effect used in the analgesic, and they produce the hypothermia, that is adverse effect. Temperature goes below normal, that's why they lost their body temperature control. Center is lost. The body temperature falls in surrounds. It does not affect in the respiration. It does not produce the motion sickness. It is not affected in the motion sickness. Okay. Now mechanism action. mechanism of action. All the neuroleptic drugs means antipsychotic drug, all the neuroleptic drugs that all are antipsychotic drug, they blocking the dopamine receptor, that D2 and D1 receptor. Okay, this is the mechanism action. Now second action on the anti-emetic action. Chlorpromazine most powerful anti-emetic effect. It is act indirectly on CTZ, acting CTZ, and that CTZ is chlorpromazine get depressed. CTZ, they are depressed, the center of emitting center is can be depressed. Chlorpromazine depress the CTZ, that's why is act as the anti-emetic actions. Next, third, ANS, chlorpromazine complex effect on ANS. It has block alpha adrenergic blocking activity, anticholinergic, weak antihistamine, and anti-5-HT action. Action on the CNS. Chlorpromazine has powerful, has a complex effect on the ANS. ANS is produced complex. How the complex effect they are produced? They are blocking the alpha adrenergic receptor. They act as an anticholinergic activity. They act as a weak antihistamine activity. They act as a anti-5-HT actions. That's why it's called as the blocking. They also having the hypothermic effect. Now the next action, CVS. All this antipsychotic drug produce postural hypotension, bicentral and peripheral action on sympathetic tone, but tolerance is developed within a week. Next is action. Local anesthetic. Local anesthetic. Local anesthetic. Chlorpromazine has a potent local anesthetic. Potent local anesthetic if it is produced by the cocaine, but it is not used for the local anesthetic because of they having the different pharmacological action, because they having the many pharmacological actions and its irritant effect. That's why it is not used as a local anesthetic. Next should be the 6 muscle effect on muscle. It relaxes the muscles. Certain type of produce the plasticity. Certain type of produce the plasticity. It does not affect in the spinal reflex. Thank you.